Okay, so good evening, everybody. So we are here today with one of our dear colleagues, Ignacio Vélazquez. So thank you, Ignacio, for being here.
Thank you.
I will present you just shortly first the company, and then I will present you Ignacio's CV. So we are VetExpertise, and we are an online company with 24 vet specialists recognized by the college or by the American or the European, and we are dedicated to our colleagues' vets 24/7 all year. So, and Ignacio is one of our collaborators. He's doing the dentistry area, and he has a really amazing CV. So I will try to present it correctly and shortly. So he got his degree in veterinary medicine at Barcelona, the Universitat Autònoma de Barcelona, in 2004. Dentistry was always his passion. So he graduated at the University Complutense de Madrid in 2006 in this area, and then he started his own company, Odontovet, that was doing mobile services in this area. He did a lot of practice all over in Spain, then he went to the United States, and then he started in dentistry, a residency program in dentistry and oral surgery at the University of Pennsylvania in 2015, right? Okay, so he complemented his training, his rotations. He did a lot of amazing stuff. And finally, he joined Ars Veterinaria Clinic, and he's the head of the dentistry and oral surgery services. And he completed his residence in 2018. Okay. Ignacio is a board certified veterinary dentist for the American Veterinary Dental College since June 2019, and is also a board certified veterinary dentist by the European Veterinary Specialists in Dentistry since October 2019. So I think I said everything. I will give the word to Ignacio. Thank you again for being here with this amazing topic.
Thank you very much, Filipa, with this for this nice introduction. Today the webinar is going to be about feline chronic stomatitis. And I'm saying feline chronic stomatitis, non-gingival stomatitis, because, well, at the end of the day, the gingiva is inside of the mouth, and stomatitis is inflammation of the mouth. So it's included in stomatitis. This is going to be an update, so it's going to be the last of the last. I'll try to include all the papers that were published during these 2 last years, including papers from this January 2022. And we're going to discuss a little bit each of those and try to present the findings and the main, let's say, ideas that we can get from those papers. Well, the first paper that we're going to discuss is not a paper itself, it's the first update that we're going to discuss. There are 2 updates, 2 papers that are reviews of others. The first of them is this that was published in 2020. And it's an update about feline chronic gingival stomatitis as a whole. And the important part of this paper is that they put all the papers that were published up to 2016. Some of them are included up to 2019, but most of them are before the 2016. In fact, the same authors presented another update in 2016 that they reviewed the therapeutic management of this disease. So this, let's say, team of authors are really into feline stomatitis, and they are putting together all this information in a really nice way. In this specific update that they published in 2020, they include one that, from my point of view, it's a really interesting approach, is one of the features that is really characteristic of feline stomatitis, that is the clinical presentation. And they describe these 2 clinical presentations that were presented in a few papers before, but they put these really nice 2 pictures here to describe that feline chronic stomatitis can be presented in 2 phenotype kinds. The first is the ulcerative, and the second could be the proliferative phenotypes. One of the papers that we're going to discuss a little bit later include an explanation of why we have this difference in the phenotype expression of this disease. But so far in this update, it's the part probably that I would like to highlight. The others are the other parts inside of this paper are pretty much summaries of the papers that were published just before the publication of this update. The most recent update comes from January 2022, so this year, and what was published inside of these Veterinary Clinics of North America journal. And in that one was dedicated to dentistry, to veterinary dentistry. So in this veterinary clinics includes a lot of different parts, of course, includes other disease and other approach to other kind of other specialties inside dentistry. But it has one that is dedicated to inflammatory conditions. This chapter of these veterinary clinics that was edited by Dr. Anderson and Dr. René, they put together all the inflammatory conditions, and they discuss specifically chronic stomatitis having its own paragraph. One of the most important parts of this update is that they put together kind of the protocol that they follow with these cases, in these specific cases. They describe the previous, then the surgery part, and then the post-surgical part treatment of the feline stomatitis, and they put together all the recommendations in this paper. COHAT, so C-O-H-A-T, means Comprehensive Oral Health Assessment and Treatment. And that's the way to, let's say, summarize what you do when you go to the surgery room, you take a look to the patient, then you diagnose, you put some x-rays together with your exploration, and then you get a diagnosis. And then after that, you do a treatment. Usually the treatment is based on polishing and scaling, and then some other treatments that can be different between patients. In these clinic care points, they put three different, they develop this in three different parts. The first one is the things that they recommend before going for surgery or for the diagnosis. And those are the bullet points that they develop in that part. After that, they go for the management after, during, or after this first surgery or this first intervention on the animal. And one of the things that they highlight and they recommend is the pain management of the patient after the surgery. They recommend to administer an opioid for the pain relief up to 72 hours after surgery. And they recommend as well to put an E-tube if it's necessary and keep the analgesia at least for 6 days. That's part of the personal recommendation, and those are included in this update in their last paper. Most things that are in this paper is like they describe that the most prevalent bacteria phyla that are included are Bacteroides, Firmicutes, Spirochetes, and Fusobacteria for these cats with stomatitis. They say that antimicrobials usually are used for the control of secondary infection. So they put antimicrobial drugs as part of the potential treatment for some complications after distractions. The antimicrobials that are more commonly used, and they include in there, is amoxicillin clavolate acid, clindamycin, and metronidazole. Then one of the things that they really strongly recommend is that not use glucocorticoids as part of the treatment, and reserve those glucocorticoids just for fractions cats on the ones that they do not allow easy modification of the treatments. So if you want to do a treatment that need a lot of, let's say, interaction with the cat, they only in that specific case, they could recommend the long-acting glucocorticoids. In their personal experience, they indicate that the efficacy of these steroid treatments decrease with time, resulting in more frequent injections and potential then risk of abuse of these kind of drugs. They highlight the use of NSAIDs, for instance, meloxicam, because they say that meloxicam, that is marketed as a liquid, it's really easy to give and it's really precise to give. And you can give it for a long time if you use the dose that is kind of low, but highlighting that sometimes that dose must be reduced as at least at the effective dose, the minimum effective dose, in order to keep that NSAID as part of the post-surgical treatment. Well, after these two updates, we're going to talk about the last papers. So those are just papers. Those are not review papers. They are original research. And the first one that we're going to discuss is based on the study of the lesion. So feline chronic stomatitis, the lesion has been described in other papers before, but in this paper that was published really recently, brought more in-depth knowledge in the CD8 positive T cells and their paper in, or the role that they have in feline chronic stomatitis. So one of the findings of this paper, of this work, is that the lymphocyte phenotype is altered in the stomatitis cat and has larger number of CD8 positive T cells. Those are effector memory cells, and those are found in the mucosa of the feline chronic stomatitis cats. They demonstrated, those authors, for the first time, that there's a systemic dysregulation of CD8 effector memory and central memory cells in cats with stomatitis. These findings that they presented suggest unresolved inflammation in which the CD8 positive T cells are activated more than once and remain in active state. This concurrent reduction in central memory cells it's supported by the concept that the central memory cells become effectory memory cells when are activated more than once by the same antigen. That could be, of course, the plate. That's the antigen that is presented in most of the stomatitis papers. The predominance of these CD8 positive T cells in blood and tissue and the shift of these cells to activated effectory memory cells is in line with the proposed underlying viral etiology that is presented in a lot of different papers, and they highlight it here again. Well, this paper includes as well transcriptome analysis of the samples. So those oral mucosal lesions that were coming from the stomatitis cats, those were found to have an enriched, so a lot of genes that are associated with the T cell signaling, with leukocyte adhesion, inflammatory signaling, and natural killer mediated cytotoxicity, among others. So the genes that were upregulated in this paper, that they found that were upregulated in this paper, were upregulated for more than 3 to 4 times, include the genes encoding for cytokines, pro-inflammatory cytokines, and receptors that were involved in T and B cell development for the activation of those cells and for the interaction. For instance, interleukin 11 or interleukin 7, those were upregulated in the transcriptome analysis of those tissues. Well, the other paper that we're going to discuss is another recent paper that it's a really interesting one. It's one that is focusing more in, let's say, the environmental stressors, so how all the factors that are around the cat can influence the development or not of stomatitis. In this case, this study that is pretty recent investigated the association of a multicat environment and the outdoor access of those cats with the prevalence of stomatitis in this population. And it was revealed that the prevalence of stomatitis was higher in a multicat than a single cat household, and that each additional cat that a household was having increased the odds of developing stomatitis in more than 70%. So for each cat, the other cats had 70% more chance to develop stomatitis. This association is discussed in the paper if it has some relationship or not with the outdoor access of those cats, and that association was not found in the paper. And it was suggested in the paper that the factors relating to the multicat environment may be then more related, or necessarily related, in addition of the infection caused to trigger development. So, for instance, the stress of having more than one cat living in the same household could be then the key, more than having access to the outdoor. So the examples that are mentioned in the article include the favoring of high rates of viral evolution and cyclic reinfections in those individuals that are a little bit more susceptible to develop stomatitis, and more susceptible or developing after being exposed by the shed of the other cats living in the same household. So multicat environment is one of the, or could be one of the risk factors for feline stomatitis. That's a really, really interesting paper, and this one is discussed in others. So once that paper was published, all the main points from this paper were included in others. So you can find those conclusions or those, let's say, thoughts that come from this paper in the papers that were published after that. Well, we jump to another one, and this paper that was published in 2021. It's a paper that includes new information of the subgingival microbiome in cats. And for this paper, they use a really novel technique. It's called a shotgun metagenomic technique. And in that one, what they do is they use big data coming from software, specific software, that all kind of information coming from the genetic sequence of a lot of potential components of the microbiome is compared with the sample. So you have a library, and then you compare it with the sample. And in this study, they include the 40 client-owned cats, and they compare the subgingival microbiota of those in the four different groups that were included in the study. The one group was the periodically healthy cats, so cats with no problems in the gingiva, no problems in the mouth. Cats, the second group was cats with naturally occurring chronic periodontitis. The third one was cats with aggressive periodontitis, and the fourth group was the cats with feline chronic gingival stomatitis. What they found is that the bacteria was the most abundant domain observed in the microbial communities. That makes sense, because we are talking about cells in the mouth, and one of the ones that you can find, of course, are first cells coming from their own patients, and second, cells coming from the plague. From the plague are mainly bacteria. So that makes sense that they found bacteria as the most abundant domain observed. The most abundant phyla that were observed of these bacteria were Bacteroidetes, and specifically in the stomatitis group. But it was not significant difference in between that group and the other three. And for the healthy group, the one that was most relevant, the phyla that was more relevant, was Proteobacteria. And that makes sense if we review the literature that we have published until then. Now it's pretty much the same. The phylum that was most significantly enriched in the sample in the healthy group was Actinobacteria. And that was that was not pretty, but was different compared with the disease group. That was pretty characteristic, let's say that. And if that was not a surprise to found in this study that the most abundant family identified in the study as a whole was the Pasteurellacea. So Pasteurella and all the Pasteurella-like bacteria. So Pasteurellacea includes the Pasteurellacea species. And those has been previously described in other papers as well. Well, so at the conclusion is that there's no difference or not at least significant difference between disease groups and the spectrum of clinical manifestations of the periodontitis and the microbiota that was presented. And other studies, of course, are necessary to study a little bit more about each of the elements of the microbiota, and if they have or not significance, clinically significance, if we related with stomatitis. It's a really long paper. It's pretty complicated, let's say, to understand all the little things that are in there. There are a lot of molecular stuff, but it's a really interesting one that gives a little bit more information specifically about the microbiota than we can find in there, and supports more or most of the findings that were published before. Well, I'm talking about microbiome. Another of the things that has been discussed recently in the last papers is the paper of the fungi. And fungi and bacteria, of course, they live in the mouth. And specifically, we can find Candida albicans as part of the biofilms. In humans, you can find Candida albicans and some kind of good interaction with, for instance, Streptococcus mutans. So in those biofilms, we can find fungi. But what is the paper of those fungi in the feline chronic stomatitis? So before entering in the conclusions or in the findings of this paper, there are three different concepts that are discussed in this paper. And to be honest, I needed to go for those before really reading the paper and study a little bit more about what really means these three, because in the paper they discuss all the findings and they related to the significance with these three concepts. The first concept is the alpha diversity. And this is a commonly used measurement tool that is used for measure the microbial diversity inside of or in between samples. So that means that how many different types of microbes are presented in a sample. The second is the Shannon Diversity Index, and that is a value that increases with biodiversity. And the third one is Simpson Diversity Index that measures the relative abundance of species. And these three are included in the paper as part of the study. So in this study, they include 28 cats, 14 were from the control cats, so clinically healthy cats, and the other 14 were stomatitis cats, so cats with stomatitis, chronic stomatitis. So they finally identify a total of 248 bacteria and 188 fungal genera. And those were measured, and the conclusions found that the alpha diversity measures for the clinically healthy cats and the stomatitis samples showed that the number of these bacteria species was significantly higher than the number of fungal species. That makes sense. So we have more bacteria than fungi. Well, that makes sense. But there were no significant difference in between the number of fungal species between the two groups. So it doesn't matter if the cat is clinically healthy or has a stomatitis, no difference in the number of fungal species. And all samples all harbor bacteria and fungi, but the interesting finding was that one of the cats had apparently no fungal species present in the sample. Well, that's an interesting finding as well. So in talking about bacterial diversity in the samples, there were more different types of bacteria were present in the clinically healthy samples. So cats that were healthy with no stomatitis, they have more different types of bacteria. And related to the fungi, the more and more diverse fungi were present in the feline chronic stomatitis sample. That's the thing that is included then in the discussion and sheds a little bit more light about the paper of this fungi. They study as well what are the core microbiome elements in each of the groups, and if in the clinically healthy are different from the stomatitis and which ones are identified in such group. So you can see here in this picture that is included in the study, the ones in the middle are the microbiome elements that were shared, so they were found in the clinically healthy and the stomatitis group, and the one on the right, they were found just on the clinically healthy cats, and the one on the left just in the stomatitis cats. An interesting thing is that the fungi species are different between the two groups, and they share just one group, that is Cladosporium. So in clinically healthy cats, the fungi that was more prevalent was Saccharomyces cerevisiae, and in the stomatitis group was Malassezia, 2 species of Malassezia. So the bacteria core microbiota analysis, that is the one in the center, showed that 15 species were part of that shared core, and there were some bacteria specific species that were more present in stomatitis and other just present in the clinically healthy cats. Well, another paper talking about etiology is one that continued with the investigation of paper of Calicivirus in feline stomatitis. This is a paper that is really interesting because it puts some really interesting stuff on the table. For instance, if we do a PCR, it's enough to do just a PCR, and we have to go for other techniques in order to really detect Calicivirus, because Calicivirus is a virus that mutates a lot, so it can change the primers that we're using in the PCR a lot. So they discussed that, and well, they found a really interesting thing, and I'm gonna go for that in a moment. So what they did, they went for this metatranscriptomic next generation sequencing, and they filter all the reads, allowing to just detect the sequence of the transcriptome that I can find in cats, so the ones that were part of the interest elements of the microbiome. So what they did is they included 19 cats, healthy cats, 23 cats with stomatitis, and they took swabs from each cat, at least one swab from each cat, And then they went for the phylogenetic analysis in order to assess the relationship between the Calicivirus isolated detected in the oral mucosa samples of one group and the other group. Well, the most uniquely abundant bacteria that was found according to the database that they used was Comanodactin bacterium. Sorry for that, but it's really difficult to read it. It was detected in 47% of the samples that came from the control cats, and in no samples from the stomatitis cats. So there was a bacteria, specific bacteria that even has its own number, you know, this has the name and then a specific number. So that specific one was just present in the healthy cats. And there was no difference in abundance, though, in between the bacteria, that specific bacteria that was found in those cats, in the control cats, and the ones compared with the database. So a lot of viruses were identified in the samples that they took. And they just focused in the Calicivirus, and they found that Calicivirus was really relevant in the stomatitis, was really present in the stomatitis cats. And regarding the PCR, the thing that I just mentioned is that they tested using this really, let's say, really updated technique to detect Calicivirus, and they compared that with the results of a PCR. And what they found that they got negative results in the PCR of samples that got positive results of this new technique. So that means that, well, we can rely on the PCR. Yes, we can, but some of the samples could be false negative. So that's one of the things that we have to have in mind. And of course, one of the things that is not surprising, and it's one of the conclusions of this paper, or the findings of those findings, is that the most differentiated expressed genes that they found on the genes from the cats, the stomatitis cats, were the ones that were associated with antiviral activity. And that makes sense as well regarding the activity of the cells that they found there and the expression of the genes against the antiviral activity. Well, and talking about treatment, one of the gold standard for the stomatitis treatment is the dental extractions. And we can find a lot of different papers in the literature talking about extractions and the results of that extractions. And this one is, it's the one that has been released, I think it was in November 2021. And these papers support the surgical treatment of feline chronic stomatitis. In this paper, they use 111 cats. They use 60 control cats, and they use 29 FIV positive cats, only FIV positive cats, and 22 only leukemia positive cats, so leukemia virus positive cats. So 60 control cats, 29 just positive to FIV, and 22 just positive to FELV. And they compare the results of that, so that not just the clinical, but not the clinical presentation, but so they compare the characteristic of those patients before the treatment and the characteristic of those patients after the treatment. Before the treatment, the FIV positive cats had significantly less caudal stomatitis than the cats from the control group. And well, the lack of that caudal stomatitis, it's probably resulted, they discussed that it's probably resulted from the concurrent medical treatment at the time of the diagnosis, which means that most of those cats were treated coming from the RDBM with steroids that makes them having less caudal stomatitis. The cats of the leukemia group have significantly less proliferative stomatitis. And now I'm linking that to the first part of this lecture, that the proliferative part of the presentation of the stomatitis is less or non-present in the leukemia cats because the wound healing is usually impaired in immunosuppressed cats, and leukemia virus can infect fibroblasts and the fibroblast precursor cells and interferes with the fibroblast function. That can explain why the oral lesions in this specific group, in the leukemia virus infected cats, were predominantly non-proliferative because those cells are already affected. So they do not proliferate. They create the ulcers, they can create ulcers, but they do not proliferate. After the treatment, the cats, they found a lot of cats with lingual ulcers, and after treatment, the cats with lingual ulcers, and independently if they were immunodeficiency or leukemia positive cats, they had 2.7 times more prone to have the worst response to the dental extraction. So they went for the extraction, the dental extraction, which is the gold standard for these patients, and the ones that presented lingual ulcers before the treatment, they had more chance to not to have a good, response to that dental extraction treatment. And they discussed that it's possible that cats with a lingual ulcer remain painful after having the surgery, and that because of that, the response to surgery is not as good as the ones that had no lingual ulcer. And dental extractions, after that, and in this paper, they said that the dental extraction resulted in significant improvement in up to 90% of cats. This is really high compared with other studies, and it's good. I mean, it's one another paper that supports this treatment, so the dental extraction. But it was up to 90% in those cats that had no retroviral disease. And it went down to 54.5% in the leukemia cats. And in the middle, when they found the immunodeficiency cats, so the FIB cats, that had a 79% improvement after the extractions. So those cats that were included in the leukemia cat had significantly worse response to the dental extractions compared with the other two groups. And this worst outcome was more or less having, let's say, relationship with, or they discussed it has this relation with the leukemia infections. And these cats, they had 7.5 more chances on having no improvement. So there was not a good result for those cats. They got not good result for those cats. And saying that 7.5 times more chances to having no improvement put them in a really difficult position. So it's really then it's hard to present then the dental extraction treatment as a really good one for this kind of patients, or at least that's what they discuss in the paper. Well, that is another one that piles up in the dental extraction treatment for these stomatitis cats, and that keeps it still as a gold standard recommendation. And talking about treatment, there were a lot of papers, or has been published a lot of papers about the mesenchymal stem cells treatment for cats with stomatitis. And most of those papers, they come from the same team. These colleagues from the UC Davis University are working with these mesenchymal stem cells treatments. And they are kind of specializing in this line of investigation. That's good because they are getting a lot of information from there. The last paper that they published is a multi-center clinical trial, and that trial was performed, if I don't remember wrong, in 3 different practices. And in these, they use either the autologous or the allogenic adipose-derived mesenchymal stem cells as a treatment. They use the let's say classic approach with these injections, intravenous injections. And in this specific case review, they included 18 cats. And all of those were refractory to the dental extractions for the treatment of the stomatitis. Of those 18 cats that they included in the study, 5 of them, so up to 28%, show a clinical cure. 45.4%, they show substantial clinical improvement, and only 5, which means 28%, they show no improvement. So with these findings, they kind of show again that this treatment, it could be a really good option for the cats that already had dental extractions, because as we know for other papers that they publish, if we don't do dental extractions, there's no improvement at all. So there's no, it's not interesting to go for mesenchymal stem cells therapy if you have not extracted the teeth, at least premolars and molars or full mouth extraction. And the clinical response of these patients, the 18 that they include in this study, was observed after 3 to 6 months after finishing the mesenchymal stem cell therapy, which means that we have to be patient. So if we give that that treatment, that medical treatment, we have to wait at least until 3 to 6 months in order to decide if that treatment was successful or not. In this paper, let's say they go for the same let's say investigation about the CD8 and CD4 ratio again, and they found one more time that if those cats that had stomatitis had a good response, those were the ones that had 15% or less of cytotoxic CD8 cells with low expression of the CD8. And that has been discussed in other papers from that same group, that it could be used as a marker for a clinical response of the mesenchymal stem cells treatment. So it's interesting because just taking a little sample of blood, you can send it to the lab, they can send you back the results saying, hey, what is the percentage of the CD8 positive T cells with low expression of the CD8, and the percentage is 15% or less, then that cat is a good candidate for going for the mesenchymal stem cells, because the chances to have a really good or good outcome after the treatment, it's pretty high. Well, and in this paper, they discuss other things. As I mentioned, those were cats that they were harbored for at least 3 different practices. Actually, I said 3, but there were 4. And these cats came to those practices with no other treatments before, at least 3 weeks before, with no other treatments. Well, those are the numbers that I just mentioned, that the clinical response was up to 72% if you put together the full response and the partial response, and just the 27.8% had no response. Okay, and this is what I mentioned about the CD8 low expression. And then another thing that they found, and it's a really interesting thing, is that the percentage of the CD8 positive T cells that tend to increase during the study cat that do not respond to therapy. So the ones that did not respond to the therapy, they have the CD8 still high or even higher than before the treatment. Another study that was published really recent, I'm talking about mesenchymal cells. If it's those mesenchymal cells they have a paper in, they have a role, let's say, in the regulation of or can have a role in regulation or immunoregulation on these chronic inflammatory conditions such as stomatitis. So why are those cells related in there, and then that why those interact with other cells. And they describe, this group has been working with different kind of lines, and what they are doing is studying the exosomes. The exosomes are little droplets, let's say, of little vesicles that those stem cells use for as an exocrine, let's say, communication process. And this group now, in this specific paper, what they do is not just describe those small vesicles, but they went for studying the size of the vesicles and the kind of proteins that they will find inside of those vesicles. And what they found is that 8 different proteins were exclusively found in the exosomes, so in these vesicles that came from the stem cells in the stomatitis group. And 5 proteins were exclusively and were found just in the exosomes of the healthy cats. 17 proteins were significantly more represented in the stomatitis group, and mostly those were related with metabolic processes, immune response, regulation of biological processes, and gene expression. Other 13 proteins were downregulated on those stem cells, and those were the ones that were mainly involved with metabolic functions. So using those tools that they use, they demonstrate the existence of different proteins in the exosomes, or in these vesicles, and different in the ones that came from the diseased patients, so the ones that had stomatitis, and they could be related with the altered biological effect. Those stem cells, by the way, they were harvested from the subcutaneous fat tissue, and not close to the mouth, but it was close to the, if I don't remember wrong, close to the caudal abdomen. So really far from there, but even with that, the expression of these vesicles were different in the stomatitis group, significantly different compared with the healthy mouth, let's say, cat group. And another treatment that has been put again in the study is the use of the recombinant feline interferon omega. We know that this is a molecule that immunoregulates locally, and that is a molecule that has been used lately, or since the last years, in a transmucosal way. In this study, what they study is the option, or what happens if we give it sub-Q instead of giving transmucosal. And what they use is 17 feline Calicivirus positive cats. 13 of them were treated with interferon subcutaneously, and 4 of them with corticosteroids, a dose of 1 milligram per kilogram subcutaneously as well. So the injections in both groups, they were given in daily basis, once per day, in the first day, second, third day, 7th day, 8th day, 19th day, 9th day, sorry, 14th and 21st day. And the clinical symptoms, they were measured in a score in the before starting the treatment, after 1, 2, 3 weeks, and after 4 weeks. And after these months, then is when they compare. And in the group with the Calicivirus positive group, they found significant differences in the score for the clinical symptoms. That was one of the things that they measure. For instance, for salivation scores, and they found significant difference too in the scores for the degree and extent of the inflammation in those stomatitis cats. And in this case, the RNA of this Calicivirus was quantified by the PCR, and the percentage increase of these in the viral copy numbers that when we're calculating using the values on the very first day and compared with the last day of the study, which means that the percentage of these Calicivirus change over the study, decreasing in the ones that were treated with interferon. So again, interferon is still a good option for treating, medically treating after full mouth extraction or partial mouth extraction as a surgical treatment. So you can use feline recombinant interferon omega for the treatment, and the percentage of success is pretty much the same as was found before in other studies that were given that they give the transmucosal this interferon. So you can use it either transmucosal or sub-Q, and the results are pretty much the same, or at least that was the thing that they described in this paper. And one paper that I found really interesting, and it was published at the end of 2021, is a study that aimed to evaluate the presence of the antimicrobial resistant genes in the bacteria that were obtained from the mouth of healthy cats and for the mouth of stomatitis cats. There were included just a few stomatitis cats in this study. Actually, there was just included 4 cats, and were included in compared with the 14 clinically healthy cats. But even with that, in this paper that they use, again, a swab to collect the sample, what they analyze is the DNA, and they compare it and include it in the database, targeting the specific antimicrobial resistant genes that are usually found in bacterial pathogens. This study looked for a simultaneous occurrence between the genes and one type of oral fungi as well, that is Malassezia. Actually, Malassezia, as you remember, in other study was discovered that was the fungi present in the stomatitis group. So that's interesting how different studies, find some elements in common. For instance, the presence of this Malassezia. So in those samples, 24 acquired antibiotic-resistant genes were identified in the oral cavity of all the 28 cats, including the study. And each of those cats at least one of these genes identified. Compared to the healthy cats, the genes that confer resistance to the different antibiotics, for instance, aminoglycosides, beta-lactams, and macrolides, were found more commonly in the oral swabs that they got from the cats with stomatitis, which means that those cats, they have more genes, so has bacteria, and those bacteria has more genes, so the bacteria they have more genes that contain resistance to these different antibiotics. And well, and this is a really interesting thing because, of course, now that we are really aware of this microbial resistance, is another reason to not to give antibiotic if it's not absolutely necessary as part of the treatment for the stomatitis. Actually, it's not part of the described medical treatment or standardized medical treatment after full mouth extraction or partial mouth extraction for this stomatitis cat. The last one that I'm going to discuss is this really interesting paper that focusing a different approach, a medical approach for the treatment, medical treatment of stomatitis cats, specifically for the pain that they suffer. And this one is they study the presence or the expression of these endocannabinoid receptors. The endocannabinoid system is in the patients or in humans or animals is an extensive and very complex signaling network that is composed of receptors and ligands and enzymes that metabolize and inside endocannabinoids. For those, what you got is a cascade of, let's say, with the receptor and all the system, a cascade that can relieve for those cells the suppression of the expression of some molecules that can be pro-inflammatory or can be related with the pain. In this study, they included 8 control cats and 8 cats with stomatitis, specific cats with stomatitis. They took samples from those cats and they sent it to the immunofluorescence assay tests. And in those assay, they test for cat-specific antibodies and immunolabel for receptors that they study for the presentation of those receptors specifically for cannabinoids. The mucosal epithelium of the control cats, the cats with no stomatitis, showed those receptors as well as the stomatitis cats. But in the feline chronic stomatitis cat group, all the receptors that were studied were markedly upregulated, really upregulated in the epithelium and the inflammatory infiltrate part of the tissue. So with that, they also discussed the presence of these cannabinoid and cannabinoid-related receptors in the healthy tissues that they discovered in the control cats and in the stomatitis ones, suggests that the possible role of this endocannabinoid system as part of the homeostasis of the oral mucosa. So it doesn't matter you have stomatitis or not, those receptors are there, but those are upregulated in stomatitis cats, which means that you can use endogenous cannabinoid to trigger that signal for the relieving of the pain in these specific cats. So they also discuss after this paper, a new line of investigation can be opened in using cannabinoid products in order to treat the pain in these specific patients, in the stomatitis cat patients. And that is the last paper that I would like to discuss in this presentation, in this lecture. I really appreciate your attention and thank you very much for being there.
So thank you very much, Ignacio, for this amazing webinar. So I learned a lot. I hope people also will learn as much as I did. And I thank you again for being here with us, with VetExpertise. And thank you all for watching. And I see you next time. Thank you all.
Thank you very much, Filipa.
Bye-bye. Thank you, Ignacio. Bye.